Okay. Well, welcome everybody to the December meeting of the Policy Development Committee. A few housekeeping points. Please can you remember to switch your mobile phone to silent. I don't think there's anybody joining me remotely. Is there?
Yeah, no.
Oh. But the meeting is being recorded and it will be available in due course on the Council's YouTube channel. And for councillors, can we please try and speak clearly so that it's picked up by the recording. And remember, it's a formal meeting and therefore don't refer to councillors or officers by their first names. There's no fire alarm planned, so if there is a fire alarm, please make your way out through the fire exit and congregate at the top of the car park. Just the agenda. Apologies, Francis.
Yes, Chair, received apologies from councillors Spear, Peter Lever, Turton, Williams, Bullard and Bushell, Chair.
Mr. Chairman, wouldn't it be nice if we could just send our best wishes to Ms. Bullard because of her accident?
Yeah, I think that's a good idea. Yeah. Right. Can we do that? Can we actually register?
I don't know anything about that, do they? What's happening?
Well, she's broken her hip, but I'm not sure exactly how it happened. But
Really?
I know on Sunday, an ambulance was there. She's in hospital at the moment.
She's back now, isn't she?
Oh, is she?
Yeah.
Yeah,
Good time to be
she was yesterday.
Moving on, the minutes of the meeting the 7th of November, which are attached to your agenda. Are they a true record?
Happy to move.
Councillor Warden? Seconded by Councillor Bushell. All in favour?
Yeah.
And that's unanimous. There are no items brought forward as a matter of urgency. Declarations of interest.
I've received none, Chair.
The next part is to agree the agenda between part A and B, confidential items, but there is no part B. Item 6 on the agenda is was to be a presentation by Vicky Rowe, the Chief Executive of the Citizens Advice Bureau, but unfortunately she can't make it tonight because there's been an accident in her family that she's had to deal with today. Which brings us then on to item 7, One Northern Devon, where Andy Beecham here, the Senior Programme Manager for Health and Equalities, representing One Northern Devon. And the reason for this is that we've done a series of events looking at particular issues that are of great pertinence to the local population, including water quality, dentistry, agriculture. And one of them was to be around health inequality, but we didn't want to retread ground already trodden, because the point of what we were trying to do is to add to something rather than just repeat it, probably worse than it would go on some. So we hope that you will be able to point us in the right direction.
Yes, certainly. Yeah. Shall I go through it then?
Please do. And then afterwards we'll have some questions and answers.
Yeah, absolutely. If you did want to ask any questions in between, feel free to stop me at any point. For those that aren't aware of who makes up One Northern Devon, it's made up of representatives from health and social care. So that's probably the bulk of our membership. So we've got the Integrated Care Board, which is the commissioners of health and social care, as you're aware. The Royal Devon, who I work for, Devon County Council Social Care, Devon Partnership Trust, who provide the adult mental health providers, primary care providers as well. And then obviously yourselves are represented on One Northern Devon alongside Torridge District Council and DCC in their other remits. We have emergency services, and then the not-for-profit sector is also represented in the form of NDVS and TTVS as the umbrella voluntary sector bodies for the area. We have Active Devon and North Devon Homes on the board. And then from a business perspective, we have representation from North Devon Plus and South West Business Council, and education from Petrock. And this is just to show you and obviously we can share these slides afterwards because I don't suppose you can see any of this, but this is just to sort of point out how the, do I have a, no. Oh yeah, there we go. Just to point out how the board or how we manage our projects. So we've got the board and then we have a programme group that works underneath that. But then we're split kind of into two areas of work. We have the development groups on the left there. And the idea behind them is that they have got particular areas of interest. So it could be around community development, or it could be around person-centred support. And they will help develop project ideas, looking at kind of the data of what the need is in the area, also what opportunities there might be up and coming for funding. And then they will set off a whole set of projects that happen on that right-hand side. So I can talk about any of the projects, and I do mention some of them further on in the presentation. But also it's really important that we connect with work that's happening at the Devon level, up at the top there, and also other partnership work that happens at our locality level. So whether that be North Devon Futures or the Community Safety Partnership, we want to ensure that we've got good links in with all that work as well. It doesn't happen perfectly, but it's the intention is to sort of link better. You're probably all aware from your own council responsibilities that there are what we call one community partnerships across North Devon and Torridge. And that all started from work that was developed in Ilfracombe, which was one of the coalition government pilots for neighbourhood community budget piloting. So Ilfracombe was one of 12, I think, national pilots that took place then. And the idea behind them really was, well, ultimately to try and pool public sector budgets. Well, that never happened. But what did happen was that the public sector, working with the communities and the private sector, joined up a lot better than they ever had. And then that idea was the One Ilfracombe board then were really sort of pleased with this progress, but wanted to see whether other communities could benefit from this. So in 2016, they set up One Northern Devon. And the idea then was to try and support other communities to do the same thing. So I think the first one after that was One Barnstaple, then there was Braunton, One Atlantic, One South Molton. And as you can see, all the way up to the last one of our sort of major towns is Holsworthy and District. The next kind of iteration of that work is we've had some lottery funded, the 3-year lottery bid. And that is to try and look at the areas that aren't our towns. So what do we do in what Devon County Council calls the hinterlands? So there'll be some work around how do we make sure that we connect and don't leave behind smaller parishes. And also, how do we make sure that some of the hidden voices are better heard? So NDVS has employed someone to work, I think they're called a health inclusion role, and also a youth role as well. So there'll be someone specifically supporting community development for youth work as well. And they're now in post. So the vision for One Northern Devon is a very broad vision around, it includes everything. It's not just about health, it's about safety, it's about being clean, connected communities, people able to meet their aspirations, equal access to education, employment, decent homes, world-class environment. And then our specific objectives at the moment are around those 6 areas. So, again, around healthy, resilient communities, supporting people with complex needs, assisting people to age healthily, reduce the health inequalities, increase the years spent in good health through increased physical activity, as well as engagement with things like nature and arts, and improving the mental health of people in Northern Devon. So you'll all be aware of the Chief Medical Officer's report, who and, you know, and we can see from the diagram there that health inequalities are worse in areas of coastal areas. So again, it's nothing new to us, but it's nice to have that kind of shown in the report that actually we do need to nationally and locally try to tackle this. So the only reason I've put this one in is because I think it shows the challenge that we've got in northern Devon and North Devon, and that none of that looks too bad, does it? We're there, we're middle of the road for everything, apparently, according to that. So middle of the road for our index of multiple deprivation and for all those indicators. But actually what we know is that there are huge disparities that's masking. And that means that, and we'll see from some of the later slides, that the disparities in North Devon are so huge, but we don't get targeted for a lot of the, you'll be aware of this, a lot of the government funding, because people just look at that and go, that's fine, you know, middle of the road. So more needs to be done for us to really shout about the needs for this.
Although, of course, sorry, can I just say that preventable deaths for this area is a lot higher, even on that slide where everything looks,
Yeah, that's true.
it's that, yeah, that's just my observation.
Yeah.
Not arguing.
What's
Yeah,
the
yeah.
preventable death?
Well, I don't exactly know what it's saying here exactly, but it'll be around, or what I do know is that there are many what we would call lifestyle diseases. So diseases that are caused by people's lifestyle that would be preventable if we stopped those things. What I don't know is whether that's only counting that or whether there's other things like road traffic collisions in there. But I can find out that and let you know, because that'll be how they collect that data. But certainly a lot of it will be around lifestyle factors that are influenced by social determinants. So in terms of what health inequalities are, unfair and avoidable differences in health across the population, and then over on in the circles, it's talking about some particular areas where we know that these health inequalities occur. So there are inequalities between people with certain characteristics, whether that's disability or any of the others on there. There are certain inequalities there. There are huge inequalities around socio-economic deprivation. There are also what's called inclusion health groups and vulnerable groups, such as the Gypsy, Roma, traveller community, people who are experiencing homelessness, people who are former offenders, care leavers, for example, as well, and geography, which may or may not be linked to deprivation, but generally is. And you'll see from this graph, from the graph over on the left, that actually we were doing quite well in this country for improving life expectancy up until very recently, after 2020, when that started to dip. So although we might say actually COVID-19 might have had a lot to do with that, it isn't just COVID-19. There are changing disease patterns around influenza, increase in deaths of despair around suicide. There's the potential effect of the economic downturn and austerity from 2010 that's only just sort of showing the impacts now, and climate emergency. And that top one really is just saying that actually the improvements might have been due to us having what we call the golden generation of health, and that's coming to its end. So this is the public health data around Devon inequalities gap, and as we can see, Ilfracombe is the worst for life expectancy across the whole of Devon. As well as healthy life expectancy as well. So and actually we'll see from the next slide that that's been updated, and it is actually a 15-year difference in life expectancy, not 10. Healthy life expectancy means that people are living those shorter years for a longer time in poor health. So that's a double whammy with that.
What's LTC?
Long-term conditions. So people with multiple health conditions, and that's in a working age population. So again, Ilfracombe's worse on that one as well. Fuel poverty, we've got Exeter as one of the worst in Devon there. Barnstaple has the highest rate in Devon of alcohol-related hospital admissions.
Wow.
Really?
Yeah.
Surprised at that.
Surprising, yeah.
And if you haven't seen this statistic, this will be one that shocks you about Ilfracombe Central Ward. 38.9% of children living in poverty in that ward. Which is
Like
just,
1.5% in Exeter, is that
Yeah,
right? That's
What-
the
yeah.
highest.
What does that mean, living in poverty?
so there's a whole range of indicators that will build mean poverty, but some of it will be around income. But the way they factor it in is to do with the income in comparison to the cost of living in that area. So the average cost of homes. So which is even worse really, because actually Ilfracombe is fairly cheap in terms of, in comparison. So they measure it across about 6 or 7 factors, I think, to get an indication of poverty. And then there's the North Devon gap. I thought you might be interested in this one as well. So between Central Ilfracombe and Barnstaple Westcott, that's the 15-year life expectancy difference. Well, I won't read all those out. You can see what's happening there. But it's interesting. You'll see that there are some large disparities even in the same town. And again, I mean, you'll know those areas better than I do, but I could probably guarantee that one's affluent and one isn't.
When I first saw these slides, Central Ilfracombe, how many houses are we talking about there? Because you mentioned the ward,
Yeah,
and it's not a ward. Central Ilfracombe is not a ward. There's 2 wards in Ilfracombe, west and east. And I don't, Central Ilfracombe could comprise of a very small number of houses. I don't know how many it does. I don't think it does, but
no,
I don't, without the figure,
yeah,
compared to Barnstaple Westcott there.
It used to be a ward.
It used to be a ward.
Yeah.
Yeah, so
I think that's what they're using in
So
the
if you've got
previous
about
ward.
2,000 houses, or less, or more.
It could be less than that, probably 1,500-ish, 1,200 tops.
So Westcott will be probably looking for about 3,500, 4,000 houses. Comparison. I just, to understand the figures.
It's households. as well
It'll
as
be the
what-
rate as well, though, so it won't be based on the numbers. It'll be the proportion of those numbers, what the rate of poverty is, for example.
Central Ward, looking at it, used to include Queen's Avenue, right the way down to Roller Road, Tors. So it's quite a large ward.
And there's also a lot of subdivision. It's a smaller units in central.
Yeah.
Mm.
So
Yeah,
it's not more, it's less like to individual dwellings.
yeah. And if you take it down, I can't remember whether it's LSO, whatever it is, that to a smaller level, you'll see predominantly the area around the High Street, Oxford Grove, that type of area. That's probably where a lot of this data comes
Yeah,
from.
that's what I was thinking. More pronounced and concentrated in those areas.
Yeah.
Definitely.
Yeah,
So it's going to be getting on to it. I mean, at the moment, the whole of that old ward, it's 40%
Yeah,
nearest that there.
So
it's
where
gonna
all
be
the
twice
nursing
that.
homes are as well. Might push up some of these numbers.
There's only one.
Not for children.
Only one.
Obviously not that one, which is shocking in itself, isn't it? The
yeah,
difference between George and Croydon.
yeah, yeah,
Look, can I get to a question I was going to ask you at the end?
yeah,
I mean, One Northern Devon's been cracking on for 8
Yeah.
years now.
yeah,
And these numbers are towards the end of that 8 years.
Yeah.
So how would you describe the success of the efforts of One Northern Devon?
It's a really good question, and we do come to that in the presentation.
Okay, fair.
Because that's exactly the question we've asked ourselves in the last year, and we think we've got some answers. So I will come to that. Yeah. But we do have a map. I haven't included it in this presentation, but we do have a map of the areas in Ilfracombe that have got the worst. I think it's just around the housing, but it might be also around deprivation. So send that afterwards if you are interested in the actual households. So this is just really about multiple disadvantage. So the point around this is that disadvantage tends to compound. So when you've got one thing, you're more likely to have the next thing, which makes it more likely that you'll get the next thing. So part of the reason it's so unfair is that, these things tend to compound with each other. So, I'll maybe to read that one. So in terms of,
Sorry,
do you want me to go back to that one? Yeah. Sorry, yeah.
Okay, thank you.
Do that one. Yeah.
Sorry, why do women hurt themselves?
I think that's more to do with just patterns of behaviour of habit. So I think there are more self-harm is just more prevalent in women and girls than it is in men and boys.
As an expression of stress or?
Oh yeah, mental health, anxiety, yeah, it's a really increasing kind of phenomenon as well. Yeah,
In schools.
yeah, huge issue in schools, which is a whole different subject as well. So just in terms of the indices of deprivation across Devon, you'll see that levels of deprivation are highest in North Devon and Torridge across Devon there, and the highest level in quintile 1, which is the 10% most deprived, is in your patch, North Devon.
But much better than the national profile.
Yeah.
Where are we?
National
bottom
profile
that
at the bottom.
I
from?
probably read that one.
Particularly having the highest proportion of the population.
Am I reading it right? The bit of the bottom row, the bottom bar that's blank
Oh, I see what you're saying.
is
Yeah.
much higher than any of the bits of Devon.
That is true. Yeah, but what you got to bear in mind there then is back to that slide that talks about North Devon as a whole not being that bad.
Fascinating though, when you look at how evenly it is spread actually. It's extraordinary.
At the bottom, it almost looks like.
They're all
it has
equal.
been
I
built up.
thought we would have great disparity, but I guess we don't. There is a bit.
You mean nationally? At the
No,
bottom?
no, yeah, that's it. No, that's because it's
Well, the
quintiles.
national
Oh,
one.
oh.
That's a bit source, yeah.
Yeah. So obviously, if we were to
I
pick,
think.
yeah.
North.
In terms of North Devon's areas of deprivation domains, because deprivation is made out of of those particular domains. Oh, I keep doing that, pressing the wrong thing. On the left-hand side there, you can see that barriers to housing and services is one of the things, as well as indoor environments.
Oh, massive.
Bit of good news though. So indoor environment across Devon is really bad, but actually outdoor, none of us will be surprised, I suppose, but the outdoor environment we're brilliant at. So any ways that we can capitalise on that asset that we've got about the outdoor environment, and there are ways, aren't there? Because we know that one of the biggest things we can do to impact on health outcomes is to increase physical activity. And having an excellent outdoor environment should be a really good enabler of that.
Doesn't an excellent outdoor environment go together with one of the other subdomains, which is about access to services, which means you're further than the doctor or the supermarket or whatever it is.
Yeah.
So, I mean, it's 6 of one, half dozen the other.
Yeah, true.
Take it one hand and give it the other.
Yeah. Yeah.
But if you get on the bike and go there.
Yeah. Yeah. Yes, so this is another one where we're showing, well, actually, Mid Devon's a bit worse than us in the barriers to housing and services. But the size of our patches is huge, is a huge barrier. So, you know, I'm always saying that we're bigger than Greater London or Greater Manchester, but actually got nothing like the transport links that they've got. So actually physically getting to places is really difficult.
It's a disaster, yeah. The more rural we go, the more a disaster it really is.
Yeah.
And that is partly why there's a barrier to people accessing their wonderful outdoor environment, because people can't get out.
Yeah.
If you live in a flat and you can't store a bike anywhere, you can afford a bike. If you live in Ilfracombe, it's hilly,
Yeah,
the bus services, you can't get to these lovely places.
yeah,
And
yeah,
you can't even get to the doctors or to college in Witheridge, so.
yeah. So in terms of the scale of poverty, again, it's the differences that are really significant here. So that one about working age adults involuntary excluded from employment varies from 3.3% in Saunton to 24.6% in both Ilfracombe and Barnstaple town centres.
And what year is the data from?
This is the latest data we've had from Devon County Council, but so we've only had this in the last month. But data source they're taking it from, so it could, I know we've got some still from the 2019 something or other.
Which is based on the 2019 index of multiple deprivation, which are probably, normally they're based on data from 2 years prior to that.
Involuntarily
Okay.
means they're ill, I guess.
So it's
Yeah.
like 9 years old, 7 years old,
It could be, or I mean,
perhaps.
that's one of the data sources that it does say about 2019, but there are others, so it might be a lot more.
There'll be some DWP, etc.
Yeah,
You've got the benefits and tax credits, one of them as well.
yeah.
Does it involuntarily say it excluded from employment means somebody who's unable to work because of a health condition, for example?
Yeah, that'll be mostly it in terms of they're on health related benefits. Yeah.
There's an irony to that, isn't there? About 3.3% of Saunton is predominantly and there's probably actually a large portion that aren't working because they're retired.
Yeah. Yeah. Yeah.
Where's the Avenue area involved?
No, it says working age adults, I think.
If they have more. Yeah, I don't know. Is there not an Abbeymoor area? I noticed something earlier on where it talked about North Devon Gap and it
Yeah, Honiton.
had Honiton in. I don't know how that slipped in. Yeah.
Can you just stick on, you say the involuntary excluded from employment
Yeah.
is mostly health related. What else is it? What else can be covered?
Well, I don't know whether it is also people that are just on that are on job seekers allowance. I don't know if it,
Yeah. Could well be.
So
Looking
they're-
for
they're-
employment.
they're looking. Maybe they've been out of
Yeah.
work for over a year.
That's not excluded, though, is it?
No.
I mean, no,
Voluntary.
yeah, I don't know. I'd have to look up on that one. If I haven't brought
It
anything
must
to write
mean
anything
somebody
down,
want-
but
It must mean somebody who wants a job that can't get it.
yeah,
Somebody who doesn't want a job.
25%.
But
That's,
being excluded
that's how I
is more of a
interpret it.
barrier than just being looking.
yeah. That's why I'm wondering if it might be over a year because I know they have a different. I know Job Centre Plus have a different sort of category when someone's been out of work for over a year. So it might be that they're either excluded at the moment because they're of their health, or that they're out of work for over a year, still looking for work.
There might be other factors as well, such as there just aren't any jobs
Mm.
in a particular sector or something like that.
Yeah.
I am surprised at those figures, though, Ken, because that's basically saying that 25% of the adults, working age adults are unemployed for some
Yeah.
reason, whether it be health or whether it be because they haven't got a job. And I can't believe
That was
What's the
always.
national statistic on that? Like,
I
6%.
I don't actually know, but I do know that from our work in Ilfracombe, that was about the figure. In fact, I think it was slightly higher for people that were on health-related benefits. Because there's such a lot of long-term conditions that are part of the whole deprivation that factor in with that. So it wouldn't surprise me if 24% is the one for being on it, for actually, out of work in that respect.
That might be carers as well,
Yeah, that's true.
where, they might not actually be showing up on the job statistics as being out of work, but
No,
they just can't work
I
because
do get that. It just seems, I mean, I'd be surprised if it was 25% in Barnstaple town centre. Maybe it's true, maybe it's true. Maybe in the centre, maybe it is.
yeah.
I will look that one up.
Oh, but but also, would that be the location? Because a lot of our services for the entire region are based in that area as well, mate. Like our homelessness services and things like that.
Yeah,
Oh, what you mean, so, yeah,
but those would be the two most deprived areas in North Devon, Barnstaple Home Centre, so, central, Warren, Barnstaple and so.
I wonder if there's seasonal work, isn't it?
Yeah,
As well.
yeah, that's another, yeah, big factor there.
Seasonal labour.
So social mobility is another area where there's a big north-south divide in just Devon as well. So social mobility is so much worse in North Devon than it is in South. And actually Torridge is, I think, certainly a couple of years ago, Torridge was at least amongst the worst in the country for social mobility, if not, I think, the worst that it highlighted there. But I don't think we're too far behind in North Devon.
yeah, but look where the UK is.
Yeah.
Slipped a long way, haven't we?
Yeah.
What's that?
In our social mobilities.
Yeah, it's awful, isn't it?
And then again, around sort of compounding factors, poverty, rurality, and health inequalities interface. So low incomes, high cost living areas opportunities are more limited, which we're aware of. Sparsely populated rural areas experience particularly high levels of disadvantage, and that's across the UK as well. There is something about the sparsity of services and populations that make this more difficult to manage. We talked about access to services and housing quality and affordability. There's a high rate of social isolation and loneliness, high levels of self-harm admissions, and this is an interesting one because there's lower levels of referral to psychological therapies. So although there's more mental health issues, there's people accessing psychological therapies less. If that makes any sense. Potentially, yeah. And then suicide is higher in peripheral rural areas and coastal communities, particularly with high risk groups such as farmers and vets. And there are more likely to be road traffic accidents in more deprived rural areas as well.
Vets are higher risk of suicide.
Yeah. Yeah, it's one of the kind of high stress jobs. I think dentists as well. I think dentists are another one. So some things from public health data that we've just talked about before, being some of the sort of key issues around housing, the challenges of the rural and coastal area, mental health, and our geographical setting. And then we did quite a bit of engagement with communities around health inequalities, and the themes more or less matched what the data showed us. So they talked about poor transport, lack of affordable housing, different types of poverty, a lot around mental health, trauma, loneliness and isolation. And when we say trauma, we're talking about adverse childhood experiences that people have that, always then have a impact later in life, particularly on health outcomes. the geographical remoteness again, and access to healthcare, as you mentioned before.
So,
So-
can I just ask you a question?
Yeah.
It goes
Oh,
back,
sorry, yeah.
it goes back one more.
Oh, one more, yeah.
The bottom one there, on the road traffic accidents,
Mm.
highest levels of persons killed or seriously injured are in the more deprived rural areas.
Mm.
Is that as proportion?
Yeah, yes, I would say so, yeah, with the rate of traffic accidents, so it won't be based on numbers.
Exactly. Because the deprived, because obviously a lot of accidents happen in rural areas. The
Mm.
fact that deprived might just be secondary, maybe.
I did ask this question a couple of weeks ago, actually, and I'm just trying to remember what the answer
60
was.
mile an hour zone in the, on the country lanes, which I still cannot understand in parts of Devon. It's just phenomenal.
Yeah, I drove into a fatal RTA earlier in April, on the way back from council business. and
Yeah,
Car just drove straight for a junction, killed a motorcyclist, but
I just,
they weren't from the area, and it was poverty was irrelevant to the issue.
yeah. I think that one of the answers I'm pretty sure that came back was around the kind of, infrastructure around, like pavements and things like that, being less available, you know, like in cities, there's a much better kind of.
Or just that relates to drink driving and certain communities.
It may well do.
It's probably just lousy roads. isn't it?
Less well maintained.
But I think
yes,
that was
exactly.
the answer I think that came back, but I can,
cost of car maintenance.
Yeah, I think the point is that, you know, if you're looking at those more deprived rural areas and the disadvantages that they've got, then one of them is also that there's a substantial risk of, or a greater risk of road traffic accidents in those particular areas.
but I can pick that up as well, Ben, if you're.
Please continue depressing us.
I know, it's horrible, isn't it? Yeah.
Merry Christmas. It's nothing but Christmas dinner tomorrow.
I did say we had a really good outdoor environment. There's a whole slide on that.
Cry on the beach.
Okay, so what has One Northern Devon been doing about it? So, in the past 2 years, we were sort of looking at kind of how we could tackle some of these challenges that came up from those themes. So in the first theme around poor outcomes in rural, deprived and coastal communities, we looked at a project called Tackling Health Inequalities with Physical Activity. So that's where we tried to target people who were in the highest risk of poor health outcomes, particularly by looking at the 20% most deprived communities and putting on various physical activity groups or activities themselves. We did this through the One Community. So the One Community's identified physical activity providers, or, you know, they didn't have to be like an exercise club. It could have been an outdoor photography club. It was things that got people moving more than they currently did. We've got a program of work called Health Devon that had quite a lot of community activities for older people. They were tackling both physical activity and loneliness. And then we've got a whole program of work called Flow, which supports people with multiple or complex needs, and most of those are in the high risk categories. That either one of those that we mentioned earlier, that they're in a high risk group like gypsy, Roma, traveller, or homeless, or they're in the 20% most deprived. And basically we look at just joining up support for them. So instead of them having to navigate the really complex system that's out there in terms of support, we a caseworker to work them through whatever matters to them. So if what matters to them is damp housing, we'll support them to get the support they need around that. If it's about being lonely, the caseworkers support them with that. So that,
Before we, I'll get you on the.
yeah.
Before you do, two questions.
Mm.
Has that helped the numbers,
Mhm.
or hasn't it been had time to?
It's helped the individuals it's helped.
Yes.
It doesn't really have a massive impact on the population.
So all those stats, I mean,
Yeah, so it's, yeah.
and the second paragraph there, it talks about alcohol-related emissions and diabetes rates and dementia being in the top 95%.
Yeah.
Does that mean the top 5%? Or is it just saying,
Yeah, that will be the worst 5%.
We're in the worst 5%.
Yeah, that should probably be.
Percentile, 95th percentile.
Yeah,
so
so we're the top 95% of alcohol related emissions, so that.
so 5% of the population.
I just wasn't on that.
Yes, yeah, so. I'm trying to think how.
And listen, the only way, I know you, I think I know what you mean.
Yeah,
But I mean, the way that reads, it means that there's only 5% of the population worse than us.
okay, yes, no,
But
it's,
you actually means only 5% better.
yeah,
Yeah, gotcha.
yeah.
Can I just ask, given like all that we've just looked at and all the fact that we've got so many terrible statistics nationally, are we not attracting like major amounts of funding? And I mean, it's probably a stupid question, but I have to ask it because of the severity of all of this. And I can see that there are projects and they're probably, like you say, smaller scale where you're testing things with smaller pots of money, but this is kind of like an emergency situation that is just going to get worse unless there's major intervention.
Yeah,
Is there any, I mean, I don't know what to say. Is there not a huge amount of money coming our way? Because if we can't advocate for it on these statistics, how can we?
I think we found from every government department that when we've tried to show them these statistics, they don't look at the small population amounts. They'll just look at the whole area and go, actually, you're not too bad. You're 50-50 in your nationally. We'll go somewhere. that's-
Falling alone can skew the whole stat because you've got,
Exactly, yeah.
the average house is probably in certain parts of that area, a couple million quid.
Yeah, yeah.
That's why we received nothing through Levelling Up.
Yeah.
So if you recall in Levelling Up, based all local authority areas into 3 tiers. Tier 1 being the highest priority areas, tier 2, tier 3 being the lowest priority area. We were in the lowest priority area. And that was predominantly because they took the district figures, and the district figures slew and hide these pockets of deprivation and these pockets of real need. If you take some of our wards, like Ilfracombe Central and Centre of Barnstable, and you compare the certain indices with, say, Blackpool, then it's comparable. It's not as bad as Blackpool, but it's not that far off. Yet Blackpool receives a huge amount of money because their deprivation is spread right across the whole area. It is a local authority area. And so that level of deprivation is much wider in the area, but it's just as acute in areas within North Devon.
But if a similar, and I'm sure somebody's done it, similar exercise was done in Cumbria or Northumberland or Lincolnshire or somewhere, could they not come up with a similar sort of thing and say, here's this town that's really bad, they ought to get shitloads of money?
Yeah, it must happen elsewhere,
Yeah, it probably does.
but that doesn't make.
But if you look at some of our wards, they are in the top 10% deprived wards in the country, or whatever it is. I can't remember the statistic.
We've got some highly affluent areas as well, haven't we?
Yeah. So on the census data, for instance, and this backs up what the statistic you were putting up just now about wage levels, wasn't it? Or the unemployment rate. But in our least deprived neighbourhood in North Devon, 3.7% of people are estimated to be income deprived. But in the most deprived neighbourhood, 30% of people are estimated to be income deprived. So we've got that wide disparity. And that's what hides it, because as you quite rightly say, Peter, if you go to Croyd, you've got houses, that are worth millions.
Yeah.
Sorry, but yeah, but I quite agree. And I'm not saying we shouldn't get money, but I'm just looking at a map here, index of multiple deprivation. And that's a bit of Cumbria. It's Barrow in Furness.
Yeah.
And red is bad. Like Ilfracombe's bright red. This is bright red too.
Yeah.
And bigger. So I'm just saying, if you were doing the same for Cumbria, you'd make the same argument.
Yeah.
And I think that
there are recognised coastal towns
Yeah.
around the country where that's the case. Barrow is one, Blackpool, Margate used to be, I think, I'm not sure what it is now.
Blackpool's the western country, isn't it?
Yeah.
it's overtaken Glasgow now, hasn't it?
Yeah, it's got the worst life expectancy in the whole of the country, and even locally.
Minehead as well. Even on the north coast in general, as you work along, we've got similar situations with Minehead, I think, as well.
Yeah, Minehead, Penzance, Ilfracombe, they're all pockets of deprivation. So you're absolutely right. Yeah, lots of authorities can point to that. Concern for us is then this is going off topic a little bit, but, you know, when the government announces its new funding landscape for local authorities, some of that is going to be based on deprivation, or a lot of it's going to be based on deprivation. And we've got a clue to that in the forthcoming financial settlement. So for us, it's how do we ensure that the deprivation indices that they use for funding recognise the pockets of deprivation, not just district council-wide.
But unitaries are going to make it even worse, aren't
That's what I
they?
mean.
Because you're going to put the pockets of deprivation into rural unitaries, and then you're going to have
Yes.
into urban areas, and then you're going to have massive rural areas that will look relatively average,
Yeah.
with huge poverty in certain areas.
I mean, I was hoping that because your LGA group came to Ilfracombe, didn't they? And we spoke to them then, and that was one of the suggestions, is the LGA group on coastal. Yeah, and actually, if they came up with the recommendations to say we need a different formula for coastal communities, you know, and we can use the Chief Medical Officer's report that just shows that red ring around the coast of deprivation. So that needs to start showing up in these funding allocations, but it just doesn't at the moment, because everyone takes things on a population basis, and the fact that we're a small population, you know, we're a huge area but a small population, that doesn't go in our favour either.
No. We just have to keep banging on about it though, don't we? Trying to get our MPs, who in these particular areas, actually shouting about it in Parliament. And trying to get, you know, cross-party support for the rural coastal areas.
Yeah.
Should we be lobbying at LGA level though, for reforms in the way that this is looked at? Is that something we should be doing?
I mean, I
In
think,
terms of funding, that's what we are starting to do. So we had a conversation with Ian, the MP, yesterday, about how we might start lobbying. And he suggested that we draft up some questions that he can put into the minister.
And at the local government association level as well, is it for us?
The Rural Services Network is another lobbying tool that we've got, and we're part of that. So they're raising concerns at the moment around the loss of the Rural Services Delivery Grant and how that's being diverted to more deprived sort of inner city areas, without recognising the needs of rural areas. So we're using that to lobby as well. The LGA, I don't think, will lobby on this because they represent all councils.
And therefore no councils.
Yeah. So they will be recognising that some councils won't want the funding distributed in the way we would like it distributed.
No, right.
and it's how we can make use of the public sector partnership as well, because all of our public sector partners are feeling this. So education say the same, health says the same. We don't get the funding that the actual figures would suggest we need to address this. So a couple of things we've been doing just to sort of try to mitigate against the fact that we've got this large geographical footprint is we had a primary care outreach pilot in Ilfracombe, where the GP went out into Bell's Place, if any of you know Bell's Place, for that vulnerable population, and every fortnight the GP is out there doing a drop-in session. So I've got, for all of these, I've got reports that I can send separately if anyone wants them. We also then did a Steady on Your Feet programme of work, which was people that were at risk of, older people at risk of falls, but it didn't have to be older people, it just generally was at older people. So in each of the communities, we've had some funding to train up postural stability instructors, and they put on in community hospitals or in community rooms these kind of a study on. It's a 24-week program, and it's evidence-based. You know, people get through this program, they will be less likely to fall over. Funding's ended for that. We also worked on a pilot around remote monitoring for people with heart failure. So what tends to happen with people with a certain type of heart failure is that they have to have regular follow-ups in the hospital, which obviously if you're living in parts of Devon where it's hard to get to Barnstaple, or you don't have the resources to get there, means that it's more difficult for you to actually get a good management of your heart failure. So this project, we got some funding to use an application for it, and people could just be monitored at home. So every day they would send their statistics off to the nurses who would assess it and get in contact if there was anything to worry about or if their medication needed altering. So it just stopped the need for them having to go into the hospital. And then obviously the community partnership development means that so much more we can work with our One Community partnerships, so that anything that does happen, we can try and make sure it happens in communities. So for example, I've just been contacted about the NHS plan that is out to consultation at the moment, and the Devon ICB want to do some consultation, in-person consultation. So they've booked a day in Barnstaple, which I said was great, you know, and they've booked it in Barnstaple Library, but that's just really going to reach the people of Barnstaple. It's not going to get to all the other towns. So I've suggested that they could ask the One Communities if they would like to do some of their own consultation in those towns on that as well. So I'm hoping that happens as well, because we've got that infrastructure, you know, we ought to use it.
There's still a lot of places outside those communities.
Yeah,
Partnerships.
yeah, that's
Me-
true. I knew you were going to say that. You see, that's why I put that one in there.
Just on that,
Yeah.
sorry, as an aside, if they are coming to do that sort of consultation again,
Yeah.
I think it'd be better to go in Green Lanes.
Oh, would you? Well, I've not booked it yet, so
Alright,
Yeah.
Barnstaple Library
Yeah.
will just take the people that go into the library, whereas Green Lanes will take everybody in the whole area that's coming in shopping and that.
yeah,
In the bit in the middle.
yeah.
That would be, yeah.
Okay. Yeah, I'll pass that on then,
Yeah.
because it's not been booked yet. Well, unless it was booked today. So in terms of the pockets of high levels of poverty, so there was a programme of work when the cost of living crisis was at its height, working again with the One Communities, to look at all the things that might be available to support people in their communities. So there was a whole kind of flurry around warm spaces and various sort of means of support that people would have, and a sort of central database that Bev and all the teams contributed to. So so we all knew what was available in those One Communities, admitting that that doesn't cover everything. I think you were pleased to know though that the new community developer is going to be doing some work in Linton, remember?
Oh, do you guys know what's going to happen?
In-
Can they let me?
With what do you mean with the GP practice?
Well, no, just
No.
what they're doing.
Yes, yeah. Well,
What this new community developer is doing.
yeah, okay, yeah, we'll get that as an action. Sorry, I should have brought a piece of paper and a pen. shouldn't I? Thank you. I don't anymore.
Too late now.
Bev's been noting my actions. So we did a project around fuel poverty, which you might have seen that. It got onto the BBC News where the GP practices contacted individuals that were at high risk of respiratory conditions, so asthma or COPD, and they asked them if they would like I'm trying to think what the call's called, but what have they called it? The energy company, the energy
361
361 Energy went and did visits to just see what they could do and then there was a small budget then to provide things like thick curtains and things like that, but also grants and look at applying for grants for their homes. So that was a project that then actually got rolled out across the whole of Devon for that one. There's been some food insecurity research through the One Communities, led by Devon County Council or commissioned by Devon County Council, which they have used for some of their policy setting. And then we've got a Poverty Truth Commission in Ilfracombe that has just launched, which we're hoping will bring some really sort of deep insights into how services can better support people that have experienced poverty. Poor mental health. So we put on various projects around arts on prescription. So a lot of people, when we asked them what would help them feel better, was things around more art type things to do, art therapies, painting, and things like that. We did a project around nature on prescription. We did a project around tackling loneliness with transport. That was through Devon County Council. And that just built transport into the project as well. So it didn't really matter what the project was. There were various projects. And again, we can give you reports on all of these. But the key thing was that we built the transport into it, because we know that's a barrier to a lot of people doing any of these activities. And then, sorry, yeah.
I was just going to ask, I think this is really good because obviously the arts is very therapeutic for people, but in Ilfracombe with the mental health forum that I've been going to till very recently, there was a lot of concern about and it's possibly not entirely related to this, about the whole idea of social prescribing as kind of not really an answer, but the only real available thing to signpost people to who've got serious mental health conditions, and how the groups such as arts and nature and everything are not set up to deal with people who've got serious mental health issues, and yet there is nothing else. And it was causing a lot of concern because the people who were running the groups felt they couldn't manage with people who really needed more care.
Yeah.
And there's nothing else. As good as the idea is.
Yeah, no, it's really true. And that's one of the things that we tried to do with our FIPA, physical activity on prescription one, was to try and build in how do we support the activity providers to be able to support people that are most vulnerable. Because talking about that kind of compounding nature, what we have found is that if people have got a mental health condition, they're almost excluded from community groups because the community groups are too afraid to do something wrong that might make things worse.
Yeah.
So there's a whole, if we are going to be, if we're trying to be moving more towards the prevention side of things, we do have to support and resource community groups to be able to do more of that, which we know they want to, but they just feel like they're not resourced and supported enough to do that.
And there's even safeguarding issues, aren't there, around all of this as well?
Yeah.
It's very complex.
And then there was the healthy ageing community connection activities, a whole set of activities in each community that took place as well. So that's what we have been getting up to over the last couple of years. So just going back, sort of circling around to your question about has it made any difference? So I will get there, but I really like this description of health inequalities. So it's where the systematic bit comes from. So these are differences in health between socio-economic groups that are unfair, as we talked about before, because there's no biological reason that these happen. The system produces them. The system that people are born into, and they're produced by the social circumstances in which they are born and live. So the fact that they're systematic means that whatever it is, the system is set up to produce them. There's a really great quote, isn't there, that the system is perfectly designed to produce the outcomes it produces. So the point I'm getting to with this one is we are all part of the system, I guess. So we all have a part to play in producing these health inequalities.
But then isn't the point though that something like One Northern Devon and bringing all the many of the key players together has a better opportunity to change the system?
Yeah.
But has it succeeded at all?
Yeah, exactly. Yeah, I'm getting there.
Okay.
I'm working our way to that. So just in terms of deprivation and how we're all, as a partnership, part of the system. So deprivation 7 domains are around income, around employment, education, health, crime, housing, and living environment. So basically all the things that the One Northern Devon partners are responsible for. That is what produces deprivation, or the index of deprivation, and that's what the system produces. So I'm leading up to the fact that we're all responsible for creating these health inequalities. And what is the difference between equality and equity? So there's loads of different pictures, aren't there, around this, but I really like this one because this one is saying that equality is where everybody gets the same thing. So if we're a service provider and we are giving everybody a bike because that's equality, but actually it takes no account of whether they need their bike adapted or whether they need a bike at all or something completely different, then we're adding to a system that produces inequity. So, down to your question, have we made a difference? I think the evaluations of all of those projects that we've done show that we've made a difference to the population that has been affected by those projects. But when you look at that amount of population in comparison to the whole of Northern Devon, you can't see it. You can't even see that difference. So we looked at that and we said, if we carry on for the next 15 years as One Northern Devon working in this project, we've got a bit of money, so we'll do something for 50 people. Oh, and we've got some more, so we'll do something for 200 people. And those projects are just limited to the people working in those projects. Things are just going to carry on getting worse. So we look back and we said, if we've got to do something completely different in order to shift the dial in Northern Devon. And one of the things we said was, we've got to get all of our workforce understanding this is an issue. You've all been horrified looking at these statistics, and we all need to be horrified, don't we? All of our workforce need to understand this and be quite horrified and want to do something about it, because we're all responsible for producing it. So we have looked at, between us, what could we do to really shift the dial in the next 15 years? And so the new suggested mission is that all people in Northern Devon can access what they need, just thinking back to the bike analogy, to live longer, healthier lives. Our system will be aligned and collaborate around the common goal of improving access, experience, and outcomes for those most disadvantaged. So what we do know is that people who are the most disadvantaged also have worse access to our services. They don't have the same access. They don't have the same experience when they get our services, and they have worse outcomes from them. So it's a bit, I don't know if you've heard of the inverse care law. That's a really old one, but the inverse care law is that the people who need the care the most get the least. That's what the data shows us, that those people that are the most unhealthy actually don't access healthcare services as much as those that are the healthiest. And there's all sorts of reasons for that. Again, but it's socially produced. So we've asked all of our partners if they'll come together and have a look at their own organisation and say, do we know who the most disadvantaged people are in our population? Do we know whether they get the same level of access? Do we know whether they get the same experience and outcomes? And if not, what could we do about it working with those populations? So one question is that we'd hope that North Devon Council will be looking at this work themselves, but also whether, we've been calling it Closing the Gap as well, which is closing the gap on health disparities. But whether North Devon Council's also got a role beyond looking at its own services in some form of accountability role for the other organisations. What do you call it when they scrutiny? And is that what you call it? Like a scrutiny of other organisations, peer reviews. Yeah. Because you're the elected representatives of our organisation, of One Northern Devon, you know, as well as being responsible for your own services, there might be a role about holding the rest of us accountable, healthcare services, etc. That was the end of my presentation with a question.
Thanks very much.
Thank you.
Members, questions? Councillor Fitness, and then Councillor Jenner.
Thanks, Jeff.
Yeah, can we just check the time?
7:34.
No, I know.
In terms of the building, it's due to be closed in 10 minutes' time.
The building's closing in 10 minutes time.
Can we, will we be able to get out anyway?
Hopefully, they're secure. I'm not sure when they're going to
There's
be.
been a militant guy that comes in and gets quite angry.
We've been here like
Much
later than that in the past.
Yeah.
Let's get all of us now.
Yeah, I've got problems with the gate up the top before.
Good, all right.
Right, very quick question. I don't know whether it's even important, but if I went round North Devon and asking people if they'd heard of One Northern Devon,
Mm.
I would say 99 out of 100 would say no.
Mm.
Is that important? I mean, do you need to raise your profile and as an organisation? I don't know where, because you're.
I think you're absolutely right about most people don't know who we are. I don't necessarily think that is important,
No.
because as long as I'd say it's more important that the partner organisations know who we are and know that we're collaborating, but I wouldn't even say necessarily, and all of those
No.
would know who we are. So I'd say there's certainly a piece of work to be done around how we can use One Northern Devon to work better together as organisations.
Know the community developers through One Northern Devon, but they wouldn't necessarily associate them with One Northern Devon.
Yeah.
No, it's true.
How much money do you have? How much funding do you get?
So we used to get more than we get. So we used to get something called an Improved Better Care Fund, and we bid into that. And in the past, we've had sort of £500,000
For how long a period?
to use that year,
Wow, okay.
which got spent on various things like the community developers at the time, social prescribers and various things like that. So it didn't go very far. Now we're only getting last year we just got from the Health and Equality NHS pot, we got £175,000. This year it's likely to be £130,000. So yeah, not a lot in the scheme of things.
I'm just intrigued because back to the point of awareness. I'm not aware of all of these issues. I'm aware of some of them mainly only because I'm a councillor, and it's horrific and it's deeply concerning. How much effort is going into comms and making sure that, because actually it feels a little bit like some of that, without being rude, some of that really is just a waste of time. Because I imagine the kind of some of those programs, they might work a little bit, but they're really not going to affect the issues.
Yeah.
But isn't it about actually pushing the biggest problem in particularly for my rural community is transport. People actually can't get to the hospitals and they can't access education, and that has a massive impact. So isn't it about flagging those issues and using comms to remind people about the particularly councillors and councilmen making decisions, the impact that those decisions have on real people's lives?
I think, you know, we have said for some time that actually we haven't got a comms resource in our team. We're a very tiny team. So we kind of rely on a lot on our partner working as well. And the aim, I think, is that if we all come together around this project, we can pool our resources a bit better. Because the trouble before is we've been relying on small pots of money that are there for doing specific things. We can't just choose what we do with them. And it just dilutes everything. Whereas if we all come together and go, we're going to look at the disadvantaged and improving access, outcomes and experience, we can then perhaps bring our comms people together to really work together to get this out.
Yeah.
Can I just clarify, are we going to be able to leave, or will we be here all night?
I don't know, Chair. Basically,
That's what we wanted to hear.
focus, they would check the room.
Are we able to contact them?
Yes.
Should we check the meeting for 5 minutes?
Yeah. 'Cause if they
Is that
arrive,
right,
they tend
numbers?
to want to clear you out. Fine.
That's unanimously approved.
For another meeting.
Yes, for another meeting too. Yeah. So members will, restart the meeting now.
Got sleeping bags, Ken?
Let's get hold of it.
Got another 15 minutes or so.
So, can I, because we've got time constraints, so we might get locked in, can I suggest well, obviously, thank you very much for coming and giving us that excellent presentation. But we've got a working group looking at health inequalities, and that we ask them to consider this and then how to best take it forward as a consequence. I mean, rather than discuss it now because it's unfortunately ridiculous, got the time. It would be nice to have.
The difficulty is, John, that because it's external security company, if we say come along at 9 o'clock and the meeting finishes at 8 o'clock, then nobody can leave the building until they come along and look at it.
Yeah.
So it's
Can we just take a key?
But I think you've, Mr. Chairman, you've actually suggested the way forward. I'm quite happy to go
I
with it.
mean, there's something prepared to move.
Yeah, I'll make it.
Yeah. Seconded by Councillor Jones, all in favour? Yeah. Right,
Thank you.
Thank you very much. If
You're
you want
very
to escape it, just in case you get locked in.
Yeah.
I look forward to receiving the presentation
Yes,
and the,
yeah, brilliant.
and the
And I've
other-
got
the
some
other
actions
stuff.
as well, yeah, yeah, lovely, thank you.
Item 8, Water Summit meeting held on the 12th of December, which I believe the Chief Executive attended
I did.
today.
I did, yeah. They are circulating the slides, so probably the best thing to do is circulate those to you once they've arrived, with a sort of fuller update. I attended with Councillor Lever and Knight and also Donna Sibley. This was a water summit that was requested by all of the Devon districts, following the work that the Housing Commission had done, the Devon Housing Commission, where we identified water quality and water supply as being blockages to development. Obviously, the Devon Housing Commission is interested in the housing crisis within Devon. The lack of supply of housing was often put down to the fact that the infrastructure wasn't there, especially in South Devon, in fact. And so they decided that we'd get all of the Devon districts together with the County Council and all of the industry experts. So they had Exeter University, people from there. They had people from South West Water, EA, Devon Wildlife Trust, Rivers Trust, etc., lots of people there. It was chaired by Professor Michael Winter, who's the chair of the Devon Local Nature Partnership. And the first speaker was Paul Arnott, who's the leader of East Devon District Council, who was one of the main people that had been asking for the summit because of issues that they'd had in Exmouth around sewage, etc. We also heard from Professor David Butler from Exeter University, who was talking about how you mitigate some of the health risks coming from wastewater. And then there was a panel discussion around the impact of climate change with the Met Office, again, somebody from academic from Exeter University, and also Carissa Newell from the Environment Agency. She then spoke around some of the regulatory activity that's taken place across Devon. And in fact, at one point, she put up a slide with 5 sort of newspaper headlines on it, showing, to demonstrate the regulatory activity that had been taking place. And 3 of those were North Devon. Got slightly picked on, but she also talked about some of the stuff that's happening at the moment, because we, if you recall, we picked this up as part of the agricultural deep dive, where some of the farmers were saying that they'd had a visit from the EA, told that they needed slurry lagoons, etc., and then were in a big sort of churn of grant applications and planning applications and so on. So she was talking about that as well. Caroline Catman from South West Water came along. She's the director for, I can't remember the actual title of her, but she looks after their sort of biodiversity, etc., and making sure that what they're doing doesn't affect the environment too much. She came along to talk about their approach to protecting the natural landscape and the natural environment. And then there was quite an inspirational talk from Kat Deeney, who's the head of environmental planning at Plymouth City Council, who talked about how they've gone into a partnership with South West Water and are looking at how you manage water in the city. So, water, surface water runoff, et cetera. So they're creating, areas of nature, which are also acting as, storage facilities. Following the meeting, I sit on the Devon Local Nature Partnership Board. So we had a meeting of the board following the meeting, which involved a number of the people that were speaking at the summit. And I think we all agreed that the next question should be coming back to district saying, okay, what are you going to do with all this information now? And we also said that what we need to be doing is reviewing it in the light of the NPPF, which came out today. Which is talking about, houses taking priority over environmental issues. And has in fact increased the number of houses that we need to provide over and above the draft that came out
Really?
a couple of months ago, yeah.
Do you know by how much?
I haven't got the figures in front of me now, but I think we've gone up by about 100 or so, something like that. So, and there's a whole load of planning, whole raft of planning changes now coming through. And I think what we need to be doing is also looking at the issues that have been brought up today around infrastructure, etc. And somehow or other working with South West Water and the likes of the EA on a more place-based approach. A number of people commented, and there was some challenge to South West Water about their approach, which is around, making profit, paying shareholders, as opposed to district councils, whose approach is serving the community and working in partnership with the community. And they held their hands up and said, that is obviously the case, because that is the model that's been set up. But they were outlining that as part of their plans coming forward, they've got, I think it was something like £200 million investment plan, I think it was, but don't quote me on the figures. But they highlighted exactly where that funding was coming from. Some of it was coming from customers, but the big majority of that funding was coming from investors. So they were making the point they wouldn't be able to invest that much if they didn't have those investors and didn't pay those investors a dividend. But it was interesting, and speaking to South West Water afterwards, they realised that they do need to work in a more place-based approach. That's what they've done in Plymouth. So it'll be interesting to start seeing how that starts to come through, especially when we've got issues like the local plan, and how they feed into that process to ensure that the infrastructure is put in place.
Yeah, it's all going to hinge on how the planning regime works out and how it can be integrated into that, isn't it?
Yeah.
I believe Councillor Jones had something to add.
Well, it's a slight segue on it, but it's probably a good opportunity to do so. Because it ties in with the ongoing work that's happening in terms of water quality. I missed the last meeting, wanted to give a very quick update. So we have had a meeting with Torridge and formed a joint working group looking at the subject specifically around water quality. Through those activities, we're looking to organise a visit to sewage works, which other councillors will be invited to. Councillor Bullard is assisting on organising that because she's got a little bit of time available at the moment. And we are in the midst of setting up a group to manage this subject, to support water testing. I've been speaking to the Rivers Trust, and we're doing a partnership alongside the Rivers Trust to apply for funding from South West Water to expedite the testing of the citizen science programme, to roll out testing as quickly as possible across North Devon and Torridge. So that's happening. And the other point that I just wanted to touch on while we're on the subject is that the government is asking for feedback on their consultation on the bathing water policy.
Yeah.
And I've drafted a response to that.
Okay.
And I was wondering if I could just read out, and we'd be happy to do that. I think generally everyone is in support, but there is an element of concern that's particularly being pushed, particularly from the angling movement, which is that the increase of bathing water areas increases access for all users to sites. which fundamentally I think most of us will agree with. The Anglican community have some concerns around that in general. But what there is, that what I have added into this response is that they need to go and look at the impact of increasing those users throughout the year on sites. So if you've got upriver locations, which are known spawning grounds for rarer species of fish, they do need to be assessing the impact of increasing access via water users all year round in those particular locations.
Is there a deadline for the response?
It's imminent, I believe.
It's about a week's time. I think.
Yeah, so I've just drafted the consultation to modernise bathing water regulations is a welcome, much needed step to improve public safety, water quality and access to rivers, lakes and coasts across England and Wales. Proposals like extending the bathing season, including water sports enthusiasts and regulation, and improving monitoring methods show a clear commitment to making these spaces safer and more enjoyable for all. It's crucial, however, that the impact on the environment and wildlife is fully considered, particularly for rivers where changes in designation or usage could affect ecosystems and biodiversity. But ending the automatic loss of status for underperforming sites is especially positive, focusing on improvements rather than abandoning those locations. We fully support these reforms and encourage everyone to take part in the consultation to help protect and enhance our waterways for people and nature alike.
The consultation ends on the 23rd. December.
That sounds very good.
So we've got 11 days.
Yes, so are we happy to put that forward as a committee or as a response?
Yeah, it's kind of difficult with that on one read through.
Yeah.
I can send it, I
Send it out.
can send it out to everyone. It's in our water monitoring group.
Uh-huh.
Well, Chair, if you're happy, you can't delegate powers to an individual councillor. You can delegate powers to an officer. So you could delegate power to me to reply
In consultation with Councillor Jones.
in consultation with Councillor.
Yeah.
And we can ask all members to respond to
Yeah.
Councillor Jones's email.
We're expecting more feedback on this as well from the lady that you're with today.
Donna.
Yes,
Yeah.
you might want to add more to it as well.
Yeah.
But I wanted to make sure we had something to move forward with.
So is everybody happy to delegate the response to the chief executive and
I'm happy with what was being said anyway, but yeah, definitely.
There might be more that we want to just double
Yeah.
check.
Yeah, and you ought to see the consultation document as well, because there's a few things that they're consulting on.
Okay.
so is that moved?
Yeah.
Yeah, seconded?
Second.
In favour?
Yep.
Right.
Done.
Thanks.
In terms of the actual meeting, I'll circulate the slides as soon as I get them. And obviously I've not had a chance to speak to the two councillors or Donna since we've got back. And I'll liaise with them to see if they've got any comments that we think could be useful.
Can I suggest we just work the note programme, item 9?
Well, I'm happy to move that, because we can update that as we go along anyway, so.
Got any dates for future health inequalities meeting yet?
Even 7, yeah. Thank you, everyone. Meeting closed. It's a bit,
Yeah.
I'm a bit uncomfortable with meetings being constrained by security.
Natural.
Uh,